premise of this study was to look at the prescribing of GLP-1s, especially among the Medicare population, and then also looking at industry payments in various forms to clinicians and looking at if there was any trends that we could see between these two things. My name is Mihir Kunte, one of the resident at University of Michigan Hospital. So the title of the article is Association between Pharmaceutical Manufacturer Payments and GLP-1 Receptor Agonist Prescribing in the United States. And I did this work along with many colleagues, including Ashwin Chetty at Yale, Dr. Joseph Ross at Yale, and Dr. Alyssa Chen, also at Yale. So the study looked at both industry payments to physicians and prescribing of GLP-1s among Medicare Part D patients. So what we did was we first looked at a cohort of physicians who actually prescribed medications and treated patients for type 2 diabetes. How we did that was we identified clinicians who prescribed metformin. The reason we did this was because while the indications for GLP-1s has recently increased, for the time period of the study, the main indication for prescribing a GLP-1 agonist was for type 2 diabetes. And so we focused our attention on those physicians and advanced practice practitioners who cared for patients with this condition. And then we used the Open Payments database. It's a database provided by the Sunshine Act, which basically requires all pharmaceutical manufacturers to report any type of industry payment that they make to physicians. And this can be in the form of multiple things. It could be a meal that they purchase for physicians. It could be a educational event that they start and sponsor and, have allow physicians to learn or clinicians to learn more about their product or a disease area. And it could also come in the form of a consulting fee or different types of training. So there's multiple types, and so in the paper we call this transfers of value, since it's such a broad topic, and it rarely has to do with direct payments to the physician. More, it's either items or services that are provided to the physician. And so we took this data and then compared it to prescribing data that is publicly available for Medicare Part D. And we looked at a set of GLP-1 agents and looked at how much they were prescribing. And basically, what we found was that there was a dose response where physicians and clinicians who received higher transfers of value were more likely to prescribe GLP-1 receptor agonists. This information is very relevant for both patients and clinicians. I think there are a few different takeaways from this data. And it's important to note that this is a cross-sectional study and it doesn't report causality, but I think there's a few reasons why we see the trends that we do. I think the first thing is that these transfer values come in many forms and they provide things like training, education, learning points for physicians and clinicians, and they also help them learn more about these drugs because they can be, very complicated, and you need to have a really good understanding of them before prescribing them. And so on the one hand, this data might reflect that there's, early adopters in anything, whether you're buying a car or whether you're, prescribing medication or doing a surgery. A lot of times there's a set of early adopters that are kind of gung-ho and wanting to, provide this new type of care to patients. In that sense, these set of clinicians might be going out of the way to attend events, to attend trainings, to attend educational things that might be sponsored by the pharmaceutical industry in order to better understand how they can take care of their patients. On the other hand, we do see that in general, in a lot of different areas, there is this like correlation between the amount of total payments of value that clinicians receive and the prescribing. And so there is some concern that maybe this is impacting the way clinicians prescribe and that clinicians may not be prescribing necessarily, the medication that's most cost effective or the medication that's most beneficial for the patient. So that's the general concern about these. And so I think these two things need to be weighed of, there can be benefits of these payments to, improve education, training to get increased access to these medications for patients. But then there's also this flip side to consider that it could be impacting the way, it could bias the way that clinicians are prescribing these medications. Given the type of data, it's hard to exactly examine the causality because it's cross-sectional data. But we do see, yes, there's a correlation that clinicians that received higher transfers of value and were more likely to prescribe GLP-1s. As I mentioned, I think there's definitely some limitations. I think the primarily is that we do see this trend and we understand that this is going on, but there's a lot of reasons why it could be happening, and I explained some of those. I think the further research would enable us to better understand exactly, what reasons are happening or, what are the different reasons. And also it might help impact policy. Of course, you want physicians and clinicians to kind of be at the forefront of science and be able to provide patients with the highest level of care and the newest level of care. And that requires clinicians being continuously educated just because medicine is continuously and rapidly evolving. It's really important to have the resources to continuously have new education and be at the forefront and learn new things. And some of that learning can come from the manufacturers who make that. But there could be policies that enable more to decrease any bias that can come from these pharmaceutical payments. And one proposal is that pharmaceutical companies can provide, an intermediary like a nonprofit organization to help run programming that is kind of verified to be unbiased and still provides the goal of, giving clinicians the top level education on a variety of like the new treatments coming out while also limiting the type of bias that could come directly from pharmaceutical companies about their products. I invite you all to read our article in the March edition of the Mayo Clinic Proceedings Journal. I'm a little biased, but I think it's an interesting article and would be excited to hear all your thoughts. Thank you so much.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.